Welcome to Lifestyle Matters. I'm Marilyn Amore. We are with Dr. Rahman at Fresno Surgical Hospital, and we're going to be talking about prostate cancer. And did you know 1 in 8 men will develop prostate cancer throughout their life? And that's a pretty scary statistic. Doctor, thank you so much for joining us.
Thank you for having me. Actually, some of the more recent data suggests that 1 in 9 men are diagnosed with prostate cancer, and that has to do with the fact that less doctors now are checking men for prostate cancer. So it's something that we really want to get out there to make sure that doctors and patients are actually being checked for prostate cancer.
And how serious is prostate cancer?
Prostate cancer is a very serious disease. It's like the second leading cause of cancer death in men. It affects men usually in their 50s and 60s, and typically there's a lot of risk factors that can cause prostate cancer, and most men with prostate cancer don't actually present with symptoms.
What if it is found early? There's more of a likely chance to have it treated?
Yes, prostate cancer, when it's found early, is extremely curable, and we're now trying to differentiate which men actually need to be tested for prostate cancer and how and kind of customize each treatment based on what their individual's cancer features are. So if cancer is found very early, most of those men can be cured and treated very, very successfully.
You mentioned that there really is no symptoms that show. So what do you how often do you recommend somebody get tested for prostate cancer?
Right. So symptoms of prostate cancer are, like you said, they can be like a silent killer. Most men don't get any sort of urinary symptoms, or if they do get urinary symptoms, they're kind of non-specific to prostate cancer. And so usually we recommend at least once a year when someone's 50, they come in to get screened for prostate cancer with blood testing and then a physical exam. And that's where we go in and physically check the prostate to make sure it feels normal.
And when someone is unfortunately diagnosed with prostate cancer, what are the next steps from there?
So then, we usually basically recheck the prostate. We kind of look to see if the cancer is spread anywhere. So we do like a CT scan and other X-rays to make sure the cancer is localized, or whether there's signs of cancer anywhere else. If the cancer is localized, then we try to do a curative treatment for those patients. So usually we talk about different forms of treatment such as radiation therapy, surgical removal, or some of the newer treatments out there such as high-intensity focused ultrasound, which we call HIFU.
Tell me more about HIFU.
So this is a new treatment that we started at Fresno Surgery Center this year. It's basically a way to target prostate cancer cells that are within the prostate and trying to leave some of the other prostate tissue alone, which actually will minimize a lot of the side effects. So we're actually able to really target areas in the prostate that have the cancer and kind of leave the other organs alone, which actually minimizes a lot of the side effects.
Are you seeing a great outcome from this procedure?
So yeah, we're very early on in our studies, but so far those patients are doing outstanding, really not having any sort of major side effects and having excellent cancer control. So we're very excited about it.
And how long is the treatment period?
So usually these patients, they come in, and the treatment is actually between a 2 and 3 hour procedure that's done at the Fresno Surgery Center, and we typically have to, the recovery is typically about a week, and after about a week of recovery, they're almost back 100%.
You're kidding me. Just so after you do the procedure, and then after a week, they're back to 100%, and then they're coming in for their checkups on a regular basis.
That's correct. Yeah, so it's one of the nicer ways because they're actually able to get back to recovery very, very quickly.
And tell us a bit about Fresno Surgical Hospital. Why do you enjoy working here?
Well, I think Fresno Surgical Hospital is one of the best places for patient experiences here in the Valley. From the time they check in, where all of our administrative staff, they treat everyone just like their own family, and then the nursing staff, the hospital staff, and the OR staff, they're just top notch. I think that just really creates a very positive environment.
I agree. One more time, tell us a little bit more about HIFU for the people that are just tuning in, because this is a great thing that you're working on.
Okay. HIFU stands for high-intensity focused ultrasound of the prostate. It's a way of killing off prostate tissue in a minimally invasive fashion. Those patients basically are treated over a 2 or 3 hour period, and the cancer is effectively treated with minimal side effects.
That's great. Well, Doctor, thank you so much for joining us, and congratulations on HIFU and working on that. That is something great that you're bringing here to the Valley.
Thank you so much.
Viewers, if you're interested in learning more about what Dr. Rahman is working on and HIFU and prostate cancer, be sure to contact Fresno Surgical Hospital. You can go on their website. You can give them a call. Thanks so much for watching Lifestyle Matters. I'm Marilyn Moore, and we'll see you next time.